welcome to Tea Time with PJ Gangsta. I am Jaybird Wells. I am your hostess, and I am with Dennis. Dennis, you are a doctor. Can I call you Dennis, or do I need to call you Doc?
No, you can call me Dennis.
Okay. And you have a book out, and you have an app out. Can you tell me just a little bit of your background and how people can find you?
Yeah, sure. Well, I'm a hospitalist trained in internal medicine. I did some extra training in infectious disease. Right now, I oversee hospitalists in my company in 19 states. We have a total of 2,000 providers between the ER doctors and hospitalists, and I'm in charge of our COVID-19 strategy in terms of treatment. I have 2 weekly calls with all of our doctors. And I also will be on a rotation in about 3 weeks where I'm in the hospital too, treating COVID patients. That's kind of my background. And I do have a book out called Your Healthcare Playbook, Winning the Game of Modern Medicine. I work with the NFL on that book. And I developed an app about 2 years ago called My Doc Replay, where you can record your visit, the key part of your visit with your doctor, and then share it with your family and anyone else, and also so you can watch it yourself over and over again, so you can remember what the doctor said. And it's been really helpful right now because patients can't visit the hospital. So normally maybe your husband would be there in a visit with the doctor, but now your husband can't, or your wife, or your daughter out of state, and you can record it and share it in a HIPAA compliant way. That's the law about privacy. And a lot of people say, well, why don't you just record it on your phone? You can do that. But the problem is that doctors are not going to want just a random recording on anyone's phone. When it's in our app, we control who gets to see it, and it's more protected. So for patients in nursing homes, it's really helpful because nobody can visit them. So anyway, that's the app.
I was definitely a bad girl. I didn't have anybody to. My husband worked a lot during my son's chemo, and so I had to have him on the phone where the doctor could hear my husband talking, so that he could ask him questions, and we had to do that several times. Even with with my gynecologist, we had to have my husband be able to ask him questions. So it's definitely important for some communication outside the room for people that don't have that access.
That's right. And my dad lives in Georgia, and he had to see his cardiologist the other day, and they were able to do My Doc Replay, and then I can watch a recording, and then I can explain everything to my dad. It's hard for him to tell me and remember everything the doctor said. And
Yeah.
doctors, most doctors are willing to do these videos now as long as it's in an app. And we're one of the first ones that actually have this out there. So it's been really helpful. We're using it in nursing homes in Austin, Texas. We're doing a pilot there, and it's free. That's the other thing.
Hey,
We're
it's
making it
free.
available free. It's free. It's free on Apple and Android. So I recommend everybody use it. It's there. And particularly now that you can't visit the hospital.
Yeah, yeah, especially with well, I know like with this COVID lockdown, I know there's like grandparents that can't see their grandkids, so and their kids won't let them near their grandkids in a different city, so it's definitely distancing families and separating them. So it's definitely a key to have better health care is to be able to be more verbal, which is
That's right. And the
funny
other thing
spoken
is,
by the witty big mouth broad that opens her trap.
well, you can also, there's a lot of virtual visits, as you mentioned. If you're doing a virtual visit over Skype or FaceTime on a computer, you can also use our app and then record it that way too. So you don't have to be in person to record it. And we found that a lot of patients, particularly when they're hearing something that's very scary, they don't remember
Well, they
what
don't
the
want
doctor
to.
said. They're not even paying attention. And I found that when I've got my knee surgery, when I woke up, I mean, it wasn't a great time to be remembering and asking questions about my instructions, but now you can look at it again and again and again.
And then now, how did you come up with the idea for this app? Because I mean, you're a doctor, you're an author. How did you come up with an idea for an app?
Well, as I mentioned, that's a great question. As I mentioned, I work with the NFL on my book. When I was studying healthcare, I did a fellowship at UC San Francisco in hospital leadership, and we were looking at the Affordable Care Act. And it was really interesting how I realized all these hospitals were going to compete against each other for outcomes. And pretty soon, cost was going to be important in healthcare. And I began to think about the NFL. They're really good at judging value, right? So I'm going to get a first round pick for this amount of money or a sixth round pick. And they do unbelievable evaluations of their players. And I realized that healthcare, we would have to do the same thing. What's the value of this procedure? How much does it cost? And value is quality over cost. So we can't just look at quality and cost. We have to look at that ratio and maximize it. And so I realized that the NFL was a great analogy, and I wrote a book with the NFL on healthcare. And during that book, I realized that, hey, the NFL has instant replay. I mean, you can watch it again and again and again and scrutinize everything about it. And I thought, why can't we do that in healthcare? And I did find a neurosurgeon that was in Long Island. He was recording these on his own, just letting his patients see it. And then I thought, why don't I develop an app and get it out there and make it available to everyone?
So, how did you have to have like training or education in producing this app, or did you have some help with some co-companies that are app producers?
Yes. So I have a partner, Adrian Sansone. He's a CEO of a company in New York, and he and I got together, and he liked the idea. We started a company, and we did all the development with our partners internally, and meaning we did all the development with an outsourced company, but we paid for it, and yeah, that was it. And it's fantastic, and it's out there. We're in discussions with some hospital chains now. We're in discussions with some technology companies to get it out to a lot more people.
How are you going to go about in advertising? I mean, are you going to make like posters, postcards? How are you going to get this out there? Your marketing strategy.
That's a great question. Right now we're focusing on channel partners. So we're talking to insurance companies, we're talking to hospitals, hospital chains, and we're talking to nursing home people that work in nursing homes, and people that really have a lot of caregivers, because our population is for people that have a caregiver, or maybe have a child where they want their spouse to see it, they can't go to the doctor. So it's really that group. It's not really just the normal healthy group, although I think they would benefit. And so our strategy now is not to have a general public facing marketing plan, but use partners and then let them use it, and they'll get their patients to use it. And that's our first strategy. When we get more money and millions of dollars, we can do TV ads. We don't have that right now.
Well, I'm sure that you could find some different cancer groups that could partner with you, because that would be very beneficial to that community.
Yes. Alzheimer's.
Yes,
So,
it's all.
we're working, we approached AARP. Of course, they're a huge group and very powerful, but, when you end up they're very selective, and it's hard. They can't market things to their entire population. You can sponsor things, but it's very expensive.
I'm going to back you up a second. You said some word I don't know if I've ever heard of before. Hospitalists?
Yes, hospitalist. That's what I am.
Explain that term, because I don't think I've ever heard it, and I've researched a ton of stuff.
Well, thank you for asking that as well. Now, hospitalists are physicians that only work in the hospital. In the late 90s, there became a trend where some primary care doctors were so busy in their office, it was very hard. In fact, I was a primary care doctor at that time, and I would go to the hospital in the morning, see my patients. I'd go to my office. I'd get there a little late. I'd go during lunch to the hospital, take care of more patients, go back to my office. I'd have a room full of patients waiting. I'd be about 30 minutes late because I had a sick patient in the hospital. And then after my office closed, I'd go to the hospital sometimes until 7 at night. And so someone really basically said, why don't we have two different doctors do this? Some that stay in the office, some that go to the hospital. And thus became the word hospitalist. It was coined by Bob Wachter, who I did a fellowship with at UC San Francisco, and Lee Goldman in New England Journal of Medicine in 1997. And now there's 60,000 hospitalists in the U.S., and we basically focus only on the hospitalized patients. And if you go to a hospital today, chances are you're going to have a hospitalist, and your primary care doctor won't be the one seeing you.
Yeah, that's kind of creepy because it sounds straight out of my sci-fi book. Um, can you tell us how to find you or your book or your app? Because it was kind of hard to find you. And could you spell your name, please? Because I spelled
Sure.
it wrong the first time when I was trying to stalk you.
That's okay. Yeah, my book, it's best to go on Amazon and find it. That's probably the best way to get it, but it's on a lot of sites. My publisher's site, so Savio Publisher, with connections to Simon and Schuster. If you go on their website, you'll see it. It's on Target. It's on Barnes and Noble. It's on all the sites, but Amazon is probably the best way. And my last name is Deruelle, pronounced Deruelle. And you can get my app. Just search My Doc Replay, basically all one word, on Apple or Android. Just search it, and it's there, and it's free.
Sweet. I appreciate having you on my show, Dennis. I would like to visit with you again if that's possible.
I'd be happy to. I'm happy to, and thanks for letting me get the word out. And you guys be safe, okay?
You too, and